that's one of the things that that we're known for, is just being a very specific culture that helps drive healthcare in the future. And so you have to love it, and then you're able to work here in such fascinating ways.
That's amazing. Amazing. I mean, culture, I wish we had more of that in medicine, where
Yes.
because I think cultural fit is really important.
It
for
is.
team building.
It is. Epic's mission is do good, have fun, make money, in that order.
Yeah.
And so our CEO sometimes tells a story about how one of her software developers was giving away this really great software for free. And she's like, why are you doing that? And he's like, do good, have fun. And so we finally had to add on, like, in small font, make money, so that people were like remembering, oh yeah, like there is actually a business here too.
This is Dr. Chethan Sathya. Thank you for being here for this episode of Northwell Health's 20-Minute Health Talk. Today, I'm joined by friend and colleague, Dr. Jackie Gerhart, the Chief Medical Officer at Epic. Jackie, thank you for being with us.
Thank you so much. I'm excited to be here.
Yeah, I get to see you like twice in a few weeks. You joined us for our gun violence prevention forum a couple weeks ago.
You're right, I did. That was wonderful. You had such an amazing turnout and some really intelligent minds thinking about a really critical problem. So thank you.
Yeah, no, it was incredible. And just to have your perspective from the Epic EMR standpoint, when it comes to a lot of these public health issues, was absolutely incredible. And we're going to get into some of those topics today. It goes without saying, you've had an incredible career, right? You are a practicing physician in family medicine. You are the chief medical officer at one of the largest EMR, EHR companies in the entire country, right? Arguably the world. And you're really at that precipice of kind of transforming the way we think about digital healthcare, how we consume information, how we deliver care. It's such an exciting journey. But I did want to ask you, I mean, how did you get here? Did you always plan when you were a family medicine physician to go into informatics, work at an EHR? Like, was that part of the plan?
It was not part of the plan. I am originally from Wisconsin. I grew up in multiple small towns. And so I've always been really loving the way that family medicine does sort of the birth to death preventive medicine kind of journey. But I actually had no idea I was going to originally be a physician at all, let alone in family medicine. I did engineering as an undergrad. I did biomedical engineering and neuroscience, and fell in love with working with my hands, working with tech, and really enjoyed it, but then found myself in multiple different labs, not really having a lot of human interaction and doing a lot more behind the scenes engineering. And that just wasn't me. And so I ended up going to med school at Mayo, and while there, thought about all the different specialties, because obviously that's a very, a specialty powerhouse there, and really just kept loving everything. And so I kept coming back to, well, I do want to deliver babies, and I do want to see people for cancer care, and I do want to have pediatric practice. And so I fell in love with family medicine, did a residency for that, and wound up back in Wisconsin to practice at the University of Wisconsin for about 8 years with a full spectrum practice, so inpatient, outpatient, OB, etc., and just loved it. Loved my patients, loved every day of it. Was not burnt out. In fact, wanted more, and kept trying to find more ways to influence in the community. For a little while, I wrote a weekly Ask the Doctor column in the Wisconsin State Journal, and did some teaching and so forth, and really, it was the people and the connections that I felt the most excited about. But then as I was thinking about how can I affect healthcare more broadly across the world, really having a practice is so beautiful and so individual, but it also means that you don't have the time or the freedom or the bandwidth or the ability to really think and paint on a broader canvas of trying to solve multiple problems across many different areas. And so somewhat serendipitously, Epic happened to be right in my backyard. Their headquarters is in Verona, Wisconsin, and I was practicing in Madison, Wisconsin, which is just 10, 15 minutes away. And I hadn't thought about it. I was thinking about either starting my own practice or maybe doing something else in tech. And really, in an odd way, it came up on my radar 2, 3, 4 different times. And finally, I was like, okay, I use Epic. I like Epic. And I think as every user of Epic thinks, especially clinical users, they think, well, if there's just this one thing I could just teach them, or if there's this one thing I could just co-develop with them, then, it could be even better. And so I had my little list, and I was like, yeah, I can try this out. Let's see how it goes. And it was the most fascinating interview and recruitment that I've ever seen or had. we can go into that at some point if you'd like, but
Yeah,
literally it's a
please.
bunch of tests. And I was post call. I had to have a mirror in the background so that it could prove that I didn't have anything that I was cheating. And I was like sitting on like the edge of my bathtub taking these tests because that was the only mirror I had in my apartment. And I was like, this is interesting. I wonder what's going to come of this. And then lo and behold, I came on campus, which is co-developed by Disney and by Microsoft architects. And so it's this like whimsical place that I was just very surprised. And then finally had an interview with some of the folks here that lead the company and just was really inspired and said, you know what? This is a company where I can actually think and build and grow and make a difference. Even on day one, they give you the autonomy to really dream big and try new things. And so I've just been thrilled. I've been here now 8 years, and it's been some of the most exciting times of my life.
And what was the test? I mean, what were they
Oh
testing
man,
you?
there's multiple. You do a verbal test, a math test, a speed test to see if you can quickly answer things. There is a like thinking out of the box questions test where
No
it
way.
asks you maybe things you've heard of from like Google interviews or so forth, where it's just something off the wall and they want to see how you're going to respond. We also have a personality test that is taken very seriously, and we literally think about how we put people in the company based on the personality test. And so yeah, we are known for hiring like less than 1%, fewer than 1% of the applications that come to Epic. And in the physician role, for example, we recently were hiring for it, and I think we went through 1,000 applications before choosing one. It's very, very thought out in the beginning so that we make sure it's the right fit. It's such a cultural, a place that's full of culture, and really that's one of the things that that we're known for is just being a very specific culture that helps drive healthcare in the future. And so you have to love it, and then you're able to work here in such fascinating ways.
That's amazing. Amazing. I mean, culture, I wish we had more of that in medicine, you know, where we're,
Yes,
because I think cultural fit is really important
it
for team
is. It
building.
is.
And
Our mission, Epic's mission is do good, have fun, make money in that order.
yeah,
And so there actually, our CEO sometimes tells a story about how one of her software developers was giving away this really great software for free. And she's like, why are you doing that? And he's like, do good, have fun. And so we finally had to add on like in small font, make money so that people were like remembering, oh yeah, like there is actually a
there's a
business here
business
too.
here.
But I do get the pleasure of really thinking about how we can do good on a daily basis. And that's why being a physician, it just translates really well from
Hmm.
doing good in your community to doing good with patients to doing good with how we're using technology. And it really feels like it's like at the core of my being.
Absolutely. And on the math part, though, I have to ask you, I mean, was it tough? Because I'm going through math problems now with my kids, and it's there's not a lot I remember there, you know, on the complicated
Yeah.
math.
I love math.
Oh, you
So
did? Okay, so you were
I
set.
didn't think it was so tough. However, there's also a computer programming test that everyone needs to take. And I'm obviously not by background a computer programmer. And so I was logicking my way through it. And I remember sitting down, and one of the things we test for is speed. And I was thinking for a long time on some of these questions. And I was like, I'm going to get this right, but I might not get this right in a quick way. And it's interesting. We want people that can think on the fly and that are really just deeply curious. That's probably the number one thing is if you're deeply curious and you come here and you both are curious and autonomous and feel like you have a vision that you can bring into reality, you're sort of given the leash to make it happen.
Incredible. Yeah, important lessons, I think, for any place that you work. To kind of create that ideal team. Yeah, and you said something, right? I mean, I think every clinician who works with an EHR of any type, I mean, is always going to feel, hey, I wish we could just develop this and this and this. And there's going to be frustrations there. But I mean, in 8 years, I can imagine how far has Epic come, right? From when you started until now.
Yeah. Well, we're really lucky to have multiple different healthcare organizations and multiple different customers, physicians that are always leading the charge on this. We have a couple sayings. One of them is imitate to innovate. It means not only are we already innovating a ton under the hood here at Epic, but oftentimes the lowest hanging fruit is that somebody's done it. They just need to write up the recipe of how they did it, and so that other people can do exactly the same thing. You don't need to recreate the wheel. And really what we find is often it's not that it hasn't been developed, it's that it actually was, and people just don't know to turn it on. They don't know how to implement it, or they've been stuck in a way of doing things that they haven't sort of pontificated how that change could actually really improve their workflow. One of the things we find, it's not really the tech in most cases, it's the change management in most cases. So how do we get people to actually want to try something new and get over that barrier of adoption? If we can convince them, it's going to really help them afterwards. So I would say it's partly leaning on or standing on the shoulders of people that have come before. We also have these specialty steering boards. I don't know if you're involved in one or not, but they're essentially, we lean on the community to figure out what's best in each one of the specialties. Where should we be going? What should we be doing? And so it's not, we have a very small clinical team at Epic. There's 14 physicians. We have nurses, pharmacists, physical therapists, et cetera. But that pales into comparison for the knowledge that all of the clinicians have that are using Epic on a daily basis at their actual organization. So really a lot of the intelligence ideas, testing that we do is with people that are using it every day. In fact, our software developers have a requirement for immersion every year, which literally means they need to go into the OR or be elbow to elbow with someone in the ED and really deeply understand the problems that they're trying to solve, and how it's not just taking the person's problem and their proposed solution. It's taking the problem, trying to break it down into its parts and figure out, is there a better solution that maybe no one's thought of yet? And that's what I think our developers are really keen on, is deeply understanding workflow and understanding healthcare, but then also reimagining how that thing could be done that hasn't been done that way before.
And the change management piece really kind of resonates as well. I'm an implementation scientist by background, and so just understanding how these things work with clinicians has always been fascinating. What have you found, really translates? Like, what are the top 2-3 kind of things that translate when it comes to change management and getting healthcare workers, clinicians to use a new part of the tool, let's say?
Yeah, I'd say number one is having your peers be champions. So if you hear from someone that you trust clinically and is, a friend or a colleague, and they've used it and they find it to be really important for them, I think that's the main way that we sort of influence other people to try something. I think secondly, it's actually a skill. It is innately a skill in each human to say, am I curious? Am I willing to change? At what would it take? Almost like when we counsel people to stop smoking, or if we counsel people to try to do their own behavioral change in medicine, it's the same thing as learning what would it take for that individual to feel like they were going to be successful, or to feel like they were able to overcome a specific barrier. For me, for example, way back when dictation was changing to speech to text, my barrier was actually eating lunch. And what I mean is I would see my patients in the morning in clinic, and then over lunch, I would eat a bite of lunch, and then I would type my stuff, right? And I would fill out my templates, and I thought I was pretty efficient and everything, but and I didn't want to have to deal with, trying to speak my care out loud. But I kept seeing all of my colleagues, and usually I'm a pretty early adopter, but I kept seeing a lot of my colleagues say, actually, this is working pretty well. So I was like, all right. So I started, using speech to text, and then I looked at my data, and we call it signal, which is this metric of how long you're spending in notes or how long you're spending in the chart. And mine fell drastically. And I was like, all right, I can't argue with the data. I guess I need to intellectually actually be on board, and I can learn to not eat my lunch at the same time I'm trying to speak my care. Since then I haven't turned back. And now I'm using Chart with Art, which is Epic's native ambient solution. And that's been always a dream of mine, even before I started at Epic, was just how can we speak our care out loud and have that happen in the background so that we can actually really impact and care deeply in the moment. And really the feeling that I get is, it's almost a feeling of relief, because instead of keeping all of the what am I going to ask next? What did they already say? Did I write that down? did I place that order? Like trying to keep like a catalog in my head. Now the catalog is being built for me on the fly, and I can just focus on what I'm thinking next, which is just such a burden relief.
Well, you bring up such a good point. I mean, at the end of the day, it's pretty simple for why most folks are going to adopt things, right? And probably in any industry, but even in healthcare, I mean, better outcomes, but really saving time.
Yeah.
And,
Yep.
I always say clinicians, almost every clinician I know, right? If you can show them through champions, like you mentioned, partners that are using something new, that they're actually saving time, it's huge. I mean, the adoption is so much easier. And that's why we're seeing ambient just take off, right? And EHR, Epic workflows. How do you think about the overall, this is a big question, but the overall health tech ecosystem as it relates to the EHR and EHR adjacent technologies, right? Because I'm sure this is a constant conversation. This comes up at many meetings, right? Epic is doing many different things. How do you guys think about working with other startups, other health technologies? And is the intention to boil the ocean over time, or is it to kind of, work collaboratively there? How do you envision that?
Yeah, maybe I'll break that down into three things. I'll do first sort of our philosophy of what we build and when, and then second, how we interact with different third parties and different vendors. And then maybe I'll end with something around like, what does the ecosystem look like now, but what do we think it looks like in the future, and how we can all kind of play in that. You'll have to remind me of those three if I forget them all.
Perfect, you got
it. So we'll start with number one. People often ask what's on Epic's roadmap. And we do, for healthcare organizations that use our software, publish our roadmaps, often years out. And it's a delicate balance. And I've always struggled with this, because if you say something too soon, then the question is are you going to get there? And luckily, we have a great track record of being able to keep all of our promises. But there's this delicate balance in the industry of how much do you give like notification beforehand that you're working on something before maybe it's fully baked, versus how much do you wait till it's fully baked and then announce it, but then have healthcare organizations that may have decided to use something else then be frustrated because they maybe wanted to go with something that was an integrated solution in the first place. So it's just this really interesting dilemma. But what we do is we essentially use these immersion trips, and we go on site and learn, and people come to Verona too, by the way, and we have these corporate visits. And we just learn, what are your goals? What are your priorities? What is working well? What's not working well? And sometimes it's something that's brand new and it's a new concept that nobody's created before. And other times it's something that's been created before that they just have like really struggled or been frustrated with. So maybe an example of that would be an ERP, like a platform for helping to manage staff and so forth. They've been around forever. Epic hasn't usually done that, but we just recently announced that we were going to do it because the tight integration between that and the rest of your health system is something that that our customers have been asking for years. Another example, way back when, we didn't do blood bank, and now we're thinking about doing blood bank. So things that were not novel, but that just really were just direct asks from our customers. So those things come on the map. But then the other things that come on the roadmap are really things that couldn't be solved without a truly integrated solution where there's one database and all the data is around the patient. I mean, we were really built, and the reason why we've never had any mergers, never had any acquisitions, why we've not taken private equity, all of that is because we want it to be truly all one code base, all based on the same system, so that no matter where the person goes, the patient goes, that they are able to access the record, but also able to use all of that wealth of knowledge that is contained in there for their continuing care. So it's like, I used to, as a physician, I used to put a bunch of information into the EHR. And to me, that felt like the exhaust of my medical care, because I'm doing my care, but then the stuff just kind of goes in there, and sometimes people look at it, but it would sit there. But we're in such a different age now where like that exhaust of information is now the fuel of everything that I'm going to do for that individual and everything I'm going to do for that population, because I have so much knowledge, not just individual knowledge, but also community knowledge, also real world evidence, where I can make better decisions now. It's just like this another tool in my tool belt. Really, it's the promise of the EHR, right? Yeah. It's not meant to just be something that you put information into. It's meant to be something that you're actually legitimately getting really good information out from, and not just information. You're getting insights and you're changing care. So that's what I'm most excited about in that frame. And when we think about working with partners, we want to work not just on what's going to make your job easier and more efficient, but really the outcomes we're trying to build for, the next 10 years is what's going to make patient outcomes more healthy, what's going to help them get to their diagnosis more quickly, what helps them to get the right treatment more quickly. And that could be something as simple as, connecting insurers and making sure that the prior auth goes through seamlessly, because that's the problem that the patient has. Or it could be something as drastic as a rare disease where I need to lean on other colleagues throughout the community who have seen something like that before and use the data and genetics to try to figure out, okay, and what am I missing? And so that's kind of how we think about both the low-hanging fruit and then working with advancing medicine style data to make sure that we're doing the right thing for all of our customers. So that's the first one. The second one, in terms of how we work with third parties. So there's multiple different resources. And in case any third parties are listening, you can go on to open.epic.com. There's a lot of information there. Actually, there's a lot of information about if you're a ambient vendor, how you can, connect through and be able to use Epic software. We have multiple examples of, different customers that use third parties integrated well within Epic. And we do a lot of exchanges on a daily basis. So speaking of interoperability, there's a misnomer that Epic really only connects with Epic, but actually about 50% of our exchanges on a daily basis, our health record exchanges, are with non-Epic entities. And that's continually increasing now with all of the CMS initiatives and making sure that really there is this transparency and information sharing, on a culture of information sharing that's happening throughout Epic. So what I would suggest is try open.epic.com. We also have a website called Showroom. And then the third is what we formerly called the Health Grid. We now call it Patient at the Heart. But the idea is it's not just about the hospital and the clinic. And this is what jazzes me as a family doc. It's not just about like what's in four walls of a hospital or a clinic. It's really all of the information that you might get elsewhere to try to advance your health. So it's your colorectal screening that you might have gotten done, sent in the mail that was done at an outside lab. It's the genetic screening that you got for not just breast cancer, but also maybe you're looking for your whole genome. Like, I think there's these things that people are trying to advance. They can do so in a couple ways. They can do it outside of the health ecosystem, which would then leave it as kind of on an island, or they can integrate all of that information within the health ecosystem. And that's really what we're trying to do, is make that seamless, that piping seamless. So yeah, happy to discuss more. And also, if you look on our website for Showroom, you can see all the different folks that we already integrate with, which is quite a few. And then I think the last thing I was saying was, how to kind of advance medicine and work with others, right? Is that right?
Yeah.
So I would say, as thinking about the healthcare ecosystem, we've always thought of it as, almost episodes of care, or, fee for service, and it's kind of what we would consider either health 1.0 or health 2.0. But I really think that we, as a unique player in the health ecosystem, have the ability to try to help shape the future of healthcare. And so it's not just what tools and software are we building, but how can we actually encourage healthcare systems that use our software, and encourage third parties that need to be solving for problems that haven't been solved for? Like, how do we move healthcare to the next level? And really, how do we serve as sort of a backbone that also allows each person, each individual, to get the healthcare they need and want, but also really moves the industry of healthcare to something that is potentially lower cost, higher reward, better, faster treatment and cures.
I love that.
There are people that absolutely circle competition.
Yeah.
And that, what a cool place to be a little bit in competition, because it actually drives you, right?
Yeah.
Like, if we didn't have good competition from some of these amazing people, amazing places that are doing amazing AI and amazing agentic build, if that wasn't part we want to be constantly innovating, and that helps push us to be constantly innovating. And so I actually see it as a huge benefit to see what others are doing and to push us beyond what we already were thinking.
Yeah, and essential. We'd still be in the dark ages of EHRs if that competition wasn't there. You mentioned a little bit about data as well, and new initiatives to maybe ingest or work with other folks to get data in. Can you give some examples there? Because I think that's really exciting.
Absolutely. So not all data comes in through a clinician putting it into the chart. I think that's what we of course need to use that and want to leverage that for insights. But you also have data that's coming through your smartwatch or your smart ring. You also have data that is coming through your glucose monitor at home. And all of these have been, sometimes different apps that are in an ecosystem that we really want to be able to integrate with. And part of me knowing the full picture of a patient's healthcare is really understanding things that not are only happening in the office, but also are happening outside of the office. And again, from a preventive medicine perspective, I would love to know more about a patient's nutrition. I'd love to know more about their exercise. But I like the idea of having the information available, but then only calling upon it when needed. And I think that's really beautiful for clinicians because, maybe at some point in the future, I'm going to want to know multiple different remote blood pressure measurements. But right now, what I most want to know is when does it go over a certain threshold, and how does that then force off a email or a campaign or a ping to the patient to say, what are your next steps? How are you going to advance your care that otherwise, unless they had come in for a visit, that I wouldn't have been able to do. So really thinking more about taking that data and it's not about the just the volume, because it needs to be, as it needs to be very well organized, and whether that be a structured way or whether we're taking in unstructured data, say from notes. The idea is that it needs to be validated and useful, and just having a pot of data is not something that actually is going to give you any kind of insights. So organizing it appropriately and being really rigorous about that is something that we take very, very seriously. So across the Epic community, multiple different healthcare organizations have signed on to share their data. And that allows you to not just look at one healthcare organization's data, but also to try to see it across the world. We have multiple different people, not just within the US, that are contributing. And so the idea is, if I can get a representative population, how can that change the care that's in front of me, and how can that change research? And so I'll put that aside for a second and say the one thing on top of it that I'm most excited about. So of LLMs, large language models, and the goal is to predict the next word. So we're building LMMs, which are large medical models, and the idea is to predict the next medical event. And so how cool would it be if you have a patient in front of you and you can look at hundreds of patients' journeys just like that patient and say, all right, in most patients, they actually end up winding up in the ED in 45 days from this. But in this patient that we did this other thing, they actually didn't wind up in the ED, but sort of very similar situation. Or what if you looked at a bunch of people, again, very similar, and you were like, man, I just don't really know this diagnosis. What am I missing? And all of the data from that journey that had happened, 3, 4, 5 years ago that we already know the answer for could be offered up and given to me in the point of care. So it's like those kinds of pieces of data. It's not just for just the individual in the room, and it's not just for finding out something. It's really for accelerating the care, giving better care, hopefully finding faster cures and delivering them in a way that is more cost effective. Because every day that you save that's, that you didn't have a diagnosis and now you do, that's one more day of anxiety that the patient and family don't have. It's one more day that you can actually look for a clinical trial. There's just the world is more open to you if you can make sense of the data of you and the rest of the community. And frankly, we often do, clinical trials and research on individual institution basis. And we get, you go through your IRB or you get your NIH funding. But really, I think the ability to also bring in real world evidence that really truly looks like the US and truly looks like the world and truly has all of that diversity because it's across such a large platform, that I think is going to really advance medicine in a way that's more precise and personalized than we've been able to before.
I mean, that's truly transformative, right? If we're going to be able to look at that holistic kind of whole person healthcare angle, and you're able to bring in social health information as well.
Yeah, you got it. So
amazing.
Actually, we can bring it in multiple ways. So in your My Chart, your patient portal, patients can enter in their own social health information. But we also, when you go, say, to, let's say you're doing sick care and you're at a nursing home, or let's say you're doing an intake in the hospital, or even you're just coming to the clinic and you're at the front desk, all of those are touch points where we all have a unified record. So all of us have access to be able to write down social determinants of health, social drivers of health. And so I think getting all of that information in there, but it also comes from other sources. It can come from payers. So we interact with insurance companies. So if they have, say, a health and wellness program as part of the payer offering, we can ingest that information as well. It also can come from outside sources in the community if they're connected. So, I mean, it's really, again, the ecosystem. It's not just how do you put it into the medical record, but it's how do we draw across the health grid and the health network to really make sure that we're all accessing the same information.
Yeah, and then like you said, I mean, one of the worst things you can do is just get a bunch of data and then not know what to do with it. And the extension of that would be, but then not be able to do what you need to do once you identify risk. So what do you guys, I mean, I know you're doing a ton of work on this, but I'm sure you're actively thinking about the intervention side as well, right? I mean.
Yes. So we're lucky in that the future, I'm already working, our whole company is working on this, the concept of the intelligent visit. So way back even before I was at Epic, I remember I had a patient of mine, I was examining her thyroid and I felt a lump. And right away in my head, I went through the things that I wanted. I was like, I want that to be written in my note. I want a TSH. I probably want a 5-needle aspiration. I might want to do a consult to endocrinology. Like I thought of all those even faster than I can speak them, but definitely faster than I can type them and faster than I can turn away from the patient and go and enter them. And so at the time, and again, a while ago, it was like, wouldn't it be amazing if I didn't have to go away from my patient and have to do the thinking like we were describing earlier. And like now that is absolutely reality. We can place orders, we can place diagnoses, we can link them up in your assessment and plan. We can, all of the things that I was sort of hoping for are reality, but it's so much more than that. It is how do I, in a real streaming environment, like put away the mouse, put away the computer, or put away the keyboard, and just have maybe a screen in my exam room. And the idea would be, I say, I wonder what we should try next for your blood pressure. And like in line on the screen for me and my patient to see, I get evidence from journals and I get evidence from real world data, and I get things that are particularly personalized and precise maybe to that person's genetics, all in line. And then I can take action right there. And I think that's really what we're talking about is like, it is about taking the action. And it's not just about giving you options is important, but how I think about my job in the future is very different than how doctors have practiced medicine for a while. Meaning, I've been thinking about this one a lot lately, which is, what does it mean to practice at the top of your license? What does that mean when an LLM can actually do better on your licensing exam than you can?
Yep.
So if that's the case, then what is my highest power? I think part of it is my clinical judgment and taking all of these different tools and bringing them to ask a patient, ask what it is that they actually want, and then synthesize that into something that's going to take action. And to me, we're moving from an era of like knowledge is the commodity, or even, like a skill set of learning it in medical school is the thing that elevates you to where that's a commodity. And really what your goal is to, if the patient just needs a prior auth to go through because that's why they're not getting care, that's totally different than if they have a significant rare disease where I need to like investigate and do maybe thousands of tests and treatment. So it's just, how do we think about our role as clinicians in an age where we have so much more information than we ever did before?
That's such an important question. I mean, because that's going to define, exactly how we're even going to interact with EHRs, right? I mean, what element of this work is going to be done there, to your point, and in many cases can be done better with LLMs and so on from an information standpoint than a lot of our opinions, right? I mean, we just can't digest the same amount of material. So I think that's a fascinating question to kind of think through.
Right.
What do you, what would you say, there's obviously competition in the EHR space, right? Epic is a dominant player. How do you view other folks who are in that space, right? And I know as colleagues and so on, I just mean more from the technology standpoint, whether it be Meditech, Oracle, right? Are there advancements coming out there that, you look at and you think they're doing differently? Do you envision a world where those are additive in the future? Just curious your take on that.
Yeah, absolutely. So when we think about EHRs, I think the first question is, what problem are you trying to solve? And I think originally all of us were starting to solve similar problem, which is keep a record of information. But by the way, the word epic, it's not an acronym. It comes from the dictionary definition of an epic poem, which is a glorious account of a nation's events. And we changed that to be patient. So it's a glorious account of a patient's events. And I think that's truly how we've thought of EHRs for a long time. But now we're thinking about it as not just history and what's happened, but again, what is the next medical event? What is the next thing that could happen to you and could be an intervention for you such that we can change the course of your health and healthcare. And so when I think about what other companies are doing, I do hear about them using AI, but oftentimes it's on specific use cases. And really what we're doing at Epic is trying to create agents and then taking those agents and trying to create healthcare intelligence. And what I mean by that is it's not just us that we are able to create software, but we turn to our healthcare organizations and customers and clinicians to come up with what is the right question to be asking? What is the next problem to be solving? And we actually just made this new this new platform called Factory, Agent Factory, where instead of us building agents, clinicians and healthcare organizations can build their own agents. It's no code. You just simply go in and explain the problem that you're trying to solve to the LLM, and then sort of give it tasks and so forth, and then actually build something. So a good example of that one of our health customers is working on right now is measles outbreaks. So they're building an agent such that if they are in an area of a measles outbreak, it can quickly identify anyone who either hasn't had a vaccination or maybe has had a lab and doesn't have enough immunity, and then identify where they are in the community. And then there's the agent underneath the hood that sees, what zip code they're in, and then can actually reach out to them and say, hey, you are one of the people that probably needs to come in and actually get some therapy right now to help, for prophylaxis. And that is something that you need within, hours, days. And we previously couldn't really do that because it was dependent on humans. It was dependent on, someone to run a list, right? But the ability to take all of that, if you think of all the information that you need to solve that problem in a matter of minutes or even seconds, but then also the creativity it takes to even have that be the problem that's being solved for, that's how I think we work uniquely with our health organizations. We're constantly on the phone with them. They're constantly going on site because it's their problem is our problem. And that has always been the first. And it just goes back to our model. We're a private company that doesn't have the tyranny of a quarter of trying to make a certain amount of earnings. And so we can literally put at the top of our main goal serving healthcare organizations and the patients that go to the healthcare organizations. And so I think it's just a completely fundamentally different model of what does it mean to be a company in healthcare that is focused on doing good and focused on customers first.
Got it. Thank you. And I mean, it gives you a different viewpoint. I mean, but do you have concerns, and that might not be the right word, but I mean, do you think often about the fact that, Anthropic, for example, getting very engaged kind of in the health information space, right? Does that strike you as a big potential disruption or more of a collaboration?
Yeah, this is not new. You might remember, multiple years ago, there were many EHRs. And as, each organization kind of did their homegrown EHR, the question was how's Epic going to do as it's a small company in the early, 70s and 80s just starting out. And I think the beauty of having our sort of goals straight and exactly what it is that we're solving for and not solving for really helps us out. And so there was the battle of multiple EHRs early on. Then there was sort of the round of Google and others getting into healthcare and then there was the round of, different insurance companies having their own minute clinics. And then there was the round of, who really is your competitor? And I think it's a great question. I think over time, who our competitors are has completely changed.
Yeah.
Still, of course, it's the, Meditechs and Oracles of the world, but like we absolutely consider both our enemies or our competitors, but also our friends, people that are trying to solve this big problem of healthcare, and we know we can't do it all. So we're trying to think like, what is it that we're partnering on?
Yeah.
What is it that we are knowing that we want to develop under the hood? And really, in this kind of, in a lot of other organizations, or I guess a lot of other industries, there's this like very, very fierce competition, and we still do feel that. But I think the main goal is, and this is what we always say to healthcare organizations, like, if our product isn't ready, or if we didn't develop it and you found something else that works better for you, use it. Like, hands down, we want you to be happy. We want you to do what's going to be best for your patients. So like, please give us feedback on what we could do better. And also, if there's something else that you think is working better, use it.
Use it.
And I don't know that there's a lot of people in like a highly competitive world that would have that kind of an attitude. It's interesting when we talk about competition. Our CEO does a class for every employee that starts at Epic called Corporate Philosophy. It's 4 hours. She teaches it. And one of the things she makes you do in the class is write down one of 5 reasons that you showed up, that you came to work, that you decided to work at Epic. And of the 5, there's paycheck. So like you want your money. Mm-hmm. There's competition. So you like the drive of the fight of trying to be able to, make something new and have it be the best. It's something interesting to do. So, you're curious, and this seems like a place that would be really great to work with curiosity. It's the mission. So like the mission of healthcare and caring for others and helping those that are giving the care for others. And then, let's see, I'm missing one. I'll come back to it. But those 4, it's our customers. Our customers. So like, do you come to work for the people that you're serving? And she will circle her answer. She does this too. And then she asks us all to circle ours. And if we have 2 that are, the same, pick one. And as the nerd, I'm, my first day, I heard the first one, paycheck, and I swear she said patient. And so I'm sitting in the audience, I'm like, me, I'm here for the patient. This is so exciting. And like no one else is raising their hand. I'm like, what's going on here? but anyway, she circles immediately customer, which surprised me because I actually thought it was going to be mission. But now that I deeply know about our company, I completely understand. But there are people that absolutely circle competition. Yeah. And that, what a cool place to be a little bit in competition, because it actually drives you, right? Yeah. Like if we didn't have good competition from some of these amazing people, amazing places that are doing amazing AI and amazing agentic build, if that wasn't part we want to be constantly innovating, and that helps push us to be constantly innovating. And so I actually see it as a huge benefit to see what others are doing and to push us beyond what we already were thinking.
Yeah, and essential. We'd still be in the dark ages of EHRs if that competition wasn't there.
Right.
So Jackie, you've spent 40 minutes with us. Thank you so much for being here. Just one last question, very briefly. Yeah. If in 10, 20 years, what's the ideal EHR interface going to look like?
The thing that I want the most is the experience we each have had so far with AI is that experience of like surprise and delight. What I want in the healthcare system, the EHR of 10 years from now, is I want to be in awe of what it helps me with. I want to be like, I didn't think of that. You're absolutely right. Maybe that's diagnosis. Or you're just like when you're interacting with an LLM and it gives you options like, do you want me to do this, or this? Yeah. And you just say yes.
Yeah.
What does it mean for you and your patient, by the way, to be able to have that kind of next level of thinking where you're truly like assisted in being, the best advocate for your own health and for others' health that you can be?
So well said. So well said. Just like your iPhone, right? Just like ChatGPT. There are things every day now that are amazing us. And I think more and more we're seeing that in a lot of our EHRs and kind of internal technologies. Jackie, thank you once again. It's been incredible to hear about all the things you're doing and really excited to see what comes next.